Hello everybody. So today's video is going to be on the topic of migraine-associated dizziness. Uh, so dizziness that's caused by migraine is actually a very common reason for dizziness and vertigo. Um, I definitely see plenty of these patients, and they're referred to me because of the dizziness and the vertigo. But not all vertigo is caused by inner ear problems. Obviously, migraine is sort of a brain and central nervous system problem, but it can cause vertigo, and which could be very similar in appearance to some of the common inner ear problems like benign positional vertigo or Meniere's disease or vestibular neuritis. How do we diagnose these patients? The simplest thing is just to ask patients, do they get migraine headaches or have they been diagnosed with that before? And most commonly they say yes. Sometimes no, but there's usually at least a history of chronic headaches. Maybe they're not called migraines, or they've never gone to the doctor for them. It's also very common that these patients have a family member who gets migraines, usually a parent or a sibling. So that's sort of a simple thing to ask. But the typical history or the story of these patients is they do get these spinning vertigo attacks. But the key is that the timing of the attacks and the length of each episode tends to be variable. So sometimes they'll get the dizziness that just lasts for a minute or two. Next time they get it, it lasts all day. Then they get it, it lasts 30 minutes. Then the next time it's 4 hours. Then the next time it's 5 minutes again. So it's sort of these variable things that can kind of happen anytime throughout the day. And sometimes there are associated headaches, and it's clearly a migraine that's kind of going along with it, but not always. We also see with these patients, there's usually a lot of nausea and vomiting associated as well. And that's true with migraine headaches too. And patients with migraine-associated dizziness, there also tends to be a lot of sensitivity to bright lights and loud noises. Anybody in the midst of one of these attacks just wants to go lie in a dark room. So that's kind of an idea. It's sort of a bit of a nebulous diagnosis, and a lot of it is sort of ruling out other problems that might be causing the dizziness. So once I have a patient and I feel like they do have migraine-associated dizziness, usually these patients respond very well to medicines that are used to prevent migraines. So if you've noticed from some of my other migraine videos, there's kind of medicines that you take every day to stop migraines, and then there's other medicines you take when you get a migraine to knock it out, basically. So it's the medicines you take every day to prevent migraines that tend to work well for migraine dizziness. So these are medicines like some of the older antidepressants like nortriptyline or amitriptyline. There are certain blood pressure medicines that can help with this, things like verapamil or propranolol. And those are actually two different types of blood pressure medicine, but they both can be effective. And then some of the actually anti-seizure medicines, things like Topamax, can be helpful for migraine dizziness. And sometimes it's sort of experimenting and playing with a couple of different ones of these before we find the one that really works well for any individual. So, if it's dizziness and vertigo is something you're struggling with, I can certainly help with that and check you out for it. And obviously it's a complicated topic and there's a lot of different things that can be going on. But come see me and hopefully we can find the right treatment for you. Have a great day.